Thanks for being there. Hepatitis is a silent killer and it's not invincible. Today on Softline, we are tackling this major public health challenge head on with our doctor guest, Dr. Umoren Akpan, who is a senior registrar, Department of Community Medicine, University of Uyo Teaching Hospital. We will dive into the world of hepatitis, discussing the latest research, treatment options, and prevention strategies. So stay tuned for an informative and enlightening conversation. Dr. Akpan, you're welcome to the show.
Thank you very much.
You're welcome.
Thank you, madam. Oh, no.
No, this is his first time. This is his first time. So, doctor, hepatitis. Oh, goodness. I didn't know it was a problem, you know. So where do we start from? Let's start from you giving us an overview of what exactly hepatitis is, ways to prevent it, and its effects globally before we come down to Nigeria.
All right. So, hepatitis is actually a viral infection that affects the liver.
Okay.
And, of course, when you say hepatitis, it just means that something is going on within the liver, some form of inflammatory activity. So what that implies is that apart from the viral hepatitis, we have other things that can also, you know, disturb the liver and cause hepatitis. So you have alcoholic hepatitis.
Oh.
Yes, and you also have fatty hepatitis. Okay, it has a medical name, but I won't bug you with that.
Okay, thank you.
Okay, so and then, you know, viral hepatitis particularly, there are about 5 options, like 5 types of viruses that could actually, you know, cause it. And, you know, interestingly, we use alphabets to label them. So you have from hepatitis A, B, C, D, and E.
Okay.
Okay, well, some research has actually identify them F and G, but they are not for human beings.
Okay.
So they've been found more in animals. Okay. But the established human viruses are A to E. Okay. And A is basically gotten through the fecal-oral route. So that is contaminated food and water. E is also gotten the same way as well. B and C would actually be where our focus would lie, because they are the ones that actually constitutes the majority of the problem. They're the ones that really have the public health significance.
That's the B and C.
Yes, and you know, their routes of transmission are basically similar. You know, through body fluids and blood.
Okay, but please, before you go, sorry, I have to come in here.
Okay, no problem.
Yeah, you said the hepatitis A is usually contracted. You usually get it through food?
Yes, I use the word fecal-oral. So,
fecal-oral.
Yeah, food that's contaminated or water that's contaminated.
Oh, okay.
Yes.
Could you please break that down? Because
okay. So fecal-oral just means someone who has the virus.
Okay.
You know, maybe passes to. So, in an environment where there's bad hygiene, you know, bad either personal or environmental hygiene, somehow that human waste that carries the virus could infect water sources, you know, or even food. Yes. And then another person ingests it and can contract the virus. However, hepatitis A virus, the body's immunity usually tackles it, so it clears it. Oftentimes spontaneously. It is dealt with by the body. Okay. So B and C, like I mentioned earlier, they have similar routes of transmission, and they're the ones that have the major public health importance. Yeah. For D operates doesn't really operate on its own. It needs someone who is already infected. It actually works with B. So D usually infects someone with hepatitis B. So they go together. So it's more like a hepatitis B, D co-infection. So D is a bit defective. Let me use that word as a virus. So it can't operate on its own. Yes.
Okay. All right. Tell us more. The hepatitis A, you've talked about the A, the B, and the C. What are the other ones?
Yes. So if I were to shed more light, actually, for B and let me just say some things about B and C. Okay. So you know, we have the normal routes, you know, through blood. So by blood I mean like, you know, sharing sharps, People who share maybe needles. You have these injection drug users, okay, that share sharps, okay. So they're at risk of contracting the virus.
Okay.
And also maybe in the case of blood transfusion, normally every blood that is transfused must pass through a process, must be screened for basic things, screened for syphilis, HIV, hepatitis B and C.
Okay.
So, of course, we're not working in a perfect, we're not operating in a utopian society. So there are instances whereby those blood products are not properly screened. So people could actually contract them.
Okay.
You know, if you are transfused with blood that is infected with any of those. And then you also have mother-to-child transmission. But that is stronger with B.
Okay.
Okay, so the child could actually get it. We use the word perinatally. So as the woman, during delivery, the child could contract hepatitis B virus. For C, the risk is very small.
Okay.
It's very, very minimal. But B, yes, is strong. And then you have the sexual route. It's very important. So it operates for both of them, sexual route. Yes.
I see why it's now a major health concern.
Yes, and you know, B is actually does not have a cure.
Okay.
So it's not curable. We just manage it. It's treatable. So it has similarities with HIV. So the patient is on treatment for life.
Okay.
While C is actually curable.
Okay.
So that is good news. It's not all bad everywhere. So yes, it's curable within 3 months with certain drugs. C can be cleared. Now B, there are instances where you may have what we call an acute infection of B, hepatitis B virus.
Okay.
Yeah, they are rare. Well, I won't call it rare, but there are instances where you have the acute infection and the body is able to clear it. Because normally for viruses, the immune system is usually able to deal with it.
Okay.
Right now you're under the weather, so I presume that you're dealing with a virus that is causing you to have, you know, symptoms of flu. And then you just need some moral support from Nancy here. And then after a few days, you'll be fine.
You'll be fine, yeah. Absolutely. Absolutely. So let's now go straight to the topic of the day, breaking down barriers, providing access to hepatitis care for all. I'm sure before you guys came up with this kind of question or topic, there must have been some problems. So we would like to discuss some of those common barriers that prevent people from accessing hepatitis care.
Okay, yeah. So basically, when you mention these barriers, the things that come to mind are basic things like cost. Okay. Lack of awareness. Okay. Limited access to healthcare. Okay. So you look at those things. Those are very significant barriers. And you know, it's quite coincidental because 2 days before my birthday, which was last month.
Oh, really?
Yeah. On July 28th, we celebrate World Hepatitis Day. So the theme for...
You won't get to invite us.
Oh, I'm so sorry. My apologies. I will...
You make up for it.
Yeah, in
That.
So yeah, so July 28th was World Hepatitis Day, and the theme was actually that is hepatitis. Let's break it down.
Okay.
So what are we breaking down? We are breaking down these systemic issues, these things I just mentioned, and in addition, stigma and discrimination.
Okay.
So we want to break down these things so that people can actually have better access to, you know, hepatitis care. So that's basically what we are talking about, if I were to shed more light on what you asked.
And then the barriers, so these barriers come from the patients. How about those ones from the hospitals?
Oh, no, perhaps you didn't really analyze what I you know, shared. Let me call them, they are just major, let me just call them again. So stigma is an issue, and it doesn't come from the patients. So it comes from the society's perception. A lot of people see viral hepatitis strictly as a sexually transmitted infection. And that's a very wrong message to pass. As we go on discussing, you find out that there's a lot of will I say, poor vaccination, at the beginning of life is a very huge culprit. So it's not really about people's lifestyle. So that's where the stigma sometimes comes from. So people with this infection are viewed as irresponsible. Yes. So that's not from the patient. The issue of cost is not from the patient. It's from the system. Okay, so it's not the patient that determines the cost of getting the drugs.
Absolutely.
The drugs are not free. Then what else did I mention? Limited access to healthcare. So that's still not the fault of the patient. So there are other issues when you look at transportation, access roads, proximity to a healthcare facility, availability of that healthcare facility, affordability. Okay, well, we've talked about cost, so keep that aside. So that's not the fault of the patient.
All right, now let's talk about the stigma. I really want to know, when other diseases, they have a way of presenting themselves. So how does hepatitis present that makes people stigmatize the patients?
Okay, yeah, so it's, that question is very important. Actually, it starts out like every other kind of, what we know to be symptoms of illnesses that we do not consider, to be serious. We call them general, constitutional symptoms like your fever, your weakness, your reduced appetite, muscle aches, joint aches and all that. And then, over time, it progresses, you have more serious symptoms. But the one that actually gets the attention of people, they have other things like maybe generalized itching, maybe abdominal swelling. Yes, that will get the attention of people. But the one that's really, really catchy is when the eyes start going yellow. Yes, so what we call jaundice. So of course, when most people just see those things, some people even attribute spiritual causes, to it. I'm sure it's not surprising to you, Nancy, that people do. When people see people with yellow eyes, they have a lot of thoughts. They have a lot of opinions, with religious and traditional backgrounds.
Absolutely.
So, and then a lot of people, like I said earlier, now associate it mainly with lifestyle. Like, okay, he must have done something bad. Maybe they just see it as purely sexual, forgetting that there are many other ways that it could be gotten.
All right, Funky Mama, you want to come in?
Yeah, most of the times when personally I hear about hepatitis, so
You're thinking.
Something I wonder, so because people do not really
know about it, right?
Know about it and do not even care that far that a lot of people might have actually taken them into consideration. So I wonder, and most especially why people talk a lot about hepatitis B and C.
Yes, now you understand.
Yes, about hepatitis B and C. Each time, people do not quickly mention A.
Not an issue.
Do you want to?
In fact, A is so in clinical practice. Okay, like I told you, most times with hepatitis A, especially if the person is not immunocompromised, meaning that the immunity is not,
it's quite strong.
Yes, like I told you, the body has a way of clearing the virus. Eventually, so it just resolves. With time. So most times, you can almost say it may even be missed by way of trying to diagnose it. It's only going to be of concern maybe if the person is pregnant or immunocompromised, like I said. But most times it's missed because it's a very acute thing. Okay, but B and C are issues, and one of the reasons why they are issues is because of the end. Okay, I didn't even mention. So we have huge concerns with the one of the commonest end complications of these infections, which is we have two majorly. So we have liver cirrhosis. I will explain that. Don't worry, don't be scared. And then we have what we call hepatocellular carcinoma. But forget about that big
That
name.
one is
Just call it liver cancer. Okay. So liver cirrhosis, you just picture a sponge, a soft sponge. You can pour water and water filters through the sponge. It's soft and it's porous.
Okay.
So the liver is like that. It does a lot of filtering for us. A lot of toxins in the body. It handles, filters the blood and all. And gradually changes begin to occur. And then scarring. Okay, so like scars begin to build up within the liver. So that spongy thing now becomes hard. So that's what, so the liver gets hard, gets a bit shrunken, becomes non-functional. So that's the liver cirrhosis we're talking about. And ultimately will lead to the liver failing, isn't it? The other aspect, the other possibility I mentioned was the liver cancer, or what we call the hepatocellular carcinoma. So you know now, cancers now, so eventually too, it breaks down the liver. So that's one of the greatest fears. In fact, that's actually what we are trying to avoid. Okay, we don't even want it to get to that point. Yeah, so that's why it's important.
So let's talk about the access to care now. So what are those strategies, that can be put in place to improve access to health care and all that? Excuse me. Especially for rural communities,
Yes. Okay, so let me just start by saying that this discussion is timely. Nigeria actually ranks as third globally in terms of hepatitis prevalence. Okay, so, or hepatitis burden, let me use that word. Yes, and we actually, there was a survey. It's a very important national survey. It's called the Nigeria Demographic Health Survey of 2018. Actually, every 5 years, that survey is released. So that survey reported that there were over 20 million Nigerians living with either hepatitis B or hepatitis C, or both. Okay, and then there were some other figures given for each of them. I won't bug you with that. But basically, yes, there is a problem with access to care. Why is this so? Because there are other programs that are doing well. We have the HIV program. We almost take it for granted. Someone being positive with HIV, you just tell the person, go to the hospital, go and access care, start treatment, don't worry about anything. Treatment is free. We have the malaria programs getting a lot of support now. So you can actually get free malaria drugs from the primary healthcare facilities once you have a positive result. Okay, you have the tuberculosis program. It's doing so well. Once you are confirmed to have tuberculosis, treatment is free. Okay, so you have all these, and they all have structures, and they are accessible because they have structures in place. So now talking about, we will now need to mirror what has been achieved with these other programs for hepatitis in order to improve care. So first and foremost, people should be able to assess. First and foremost, people should know what this thing is. Okay. So the lack of awareness is a problem. We need more education. I thank God I'm doing my part now. Okay, so I'm contributing my own quota, but there needs to be more education taken to these areas, like you said. They need to be sensitized, enlightened. What is this condition and what do you need to do? And then, okay, they need to have access to testing points. So we need to decentralize testing points. Yes, we need to have what we call point of care testing. So people can just come, to a place that is proximal to them within the community, and they get tested. And then they can immediately assess treatment. Now, in reality, like I told you, there's no special support for hepatitis now.
Global, outside of national.
Yes, nationally, there's no clear, even though on the 28th of July, World Hepatitis Day, the Federal Ministry of Health, in conjunction with some partners, actually launched a program called Project 365. So we are very expectant. Of course, it's quite early. It was just last month, so I believe the rollout will take some time, but we're very expectant. What that project was saying or offering is that for the next 1 year, there will be free hepatitis screenings on a daily basis that will be accessible, every day for this 1 year.
Okay.
And then there'll also be free treatment for hepatitis C.
Okay.
Remember, I told you that hepatitis C is the curable one. Okay, so it seems like it's more cost effective. The mention is not made of treatment support for hepatitis B because that is lifelong.
Okay.
But mention is made to support the availability of what we call the first birth dose for hepatitis. Since 2004, there was a vaccine, hepatitis vaccine introduced at birth. So if you have any of your friends that just delivers now, within 24 hours, the child should get a vaccine. So this program is actually saying that they're also going to ensure that that vaccine is available. So all these things I've mentioned are the things that actually should happen so that people can access care. On the issue of managing hepatitis B virus now, so it's an issue, we need to have support for that. Yes, that the same way people get HIV drugs for free, they should be able to get lifelong
Help.
management.
I'm just wondering, hepatitis didn't just start today. It
Yes.
has been on for a while. So how
Yes.
come it doesn't have structures like all these other major diseases you've mentioned?
Yeah.
Was it that we neglected that area or we didn't have much of it,
Okay, well, you see, there's so many. We are operating within a resource limited setting. Okay, so I think last time I checked, I think we're still third world. Have we upgraded?
No,
Yes, so-
even though we are still third world.
So we're operating. Even though yes, there's a lot of emphasis on health now. In fact, there was an agreement, by African heads of states some years ago
Okay.
that the budget that no country should actually allocate less than 15% to health as a budget. So but over the years, despite that meeting, I don't think we've had higher than 6 point something percent. So there are meager resources.
Okay.
The resources are very finite. So government has to prioritize.
Okay.
So, another thing is when you want to make an argument, you need to be able to provide adequate evidence for it. So you see the other programs I mentioned, malaria, tuberculosis, somehow, a lot of arguments have been made for them. There's a lot of data on ground showing how serious their burden was and how significant they were. So I think we're just gradually coming to give attention to hepatitis.
All right, so
Yes.
we'll go on a very short break, and then when we come back, we'll talk about how we can leverage technology in getting access to some of the hepatitis care. All right, we'll go on a very short break, and we'll be right back. Stay with us. All right, thank you so much for being there. We're still talking hepatitis and access to health care. Dr. Akpan, I was talking about, or I wanted to ask about leveraging on technology. These days, when you mentioned the fact that other diseases like HIV, tuberculosis, they already have structures on ground. I just figure out that we have a long way to go.
Yes.
But when will this kind of structure be made for hepatitis before we begin to get positive results from those access and from those structures? But now, since we have technology, how easy can people leverage it, to be able to get access to hepatitis care? And if you know some of those means, you can also share with us.
Okay, so basically, in the area of technology, still quite nascent. The exploration of technology for hepatitis care, but we've had most of these suggestions, which I'm about to make, actually being employed for other programs. Okay, so for instance, first and foremost, you talk about trying to improve adherence. So adherence is like trying to ensure that the clients, stay faithful to taking their drugs. Okay, remember I talked about hepatitis B virus. It's lifelong. So even though we are not practicing what we call directly observed treatment, which is whereby we can actually monitor that they are taking the drugs. But in terms of technology, we could employ means such as, the SMS reminder systems, which have been used successfully for the HIV program. So there are automated messages that are sent to remind people to take their drugs, and remind them of basic things they need to do to stay healthy. Also, we have used, when we're trying to do an immunization coverage for other programs, there have been the use of drones to, convey materials, vaccines to actually the points they are needed. So we could also consider that maybe for hard to reach areas, we could, in future, we could actually transport some of those things there. Maybe testing kits, but that is not actually in use. So I'm just giving you prospects. And then you also talk about RDTs, the use of RDTs. So that is rapid diagnostic tests at points of care. So people, there are a lot of complicated, will I say, complex tests to actually screen for hepatitis. But with these RDTs, it's simple technology. So that is actually being employed now. Yes, it's actually being employed. We have, for hepatitis B, we have rapid diagnostic kits that are pre-qualified by the World Health Organization. And that's helping a lot. There are other futuristic things we could consider, because we need to synergize our data. Remember, I told you that data is what actually helped the other programs to gain relevance. So perhaps we can consider the use of artificial intelligence for data analytics, to ensure that we have a seamless flow of data. We have a centralized hepatitis registry that is, of course, hopefully not paper-based. And then we can also have real-time data. We understand the trends, we understand the burden. So all these are ways that we can actually use technology to actually improve yes, care.
All right, before we talk about government policies and all that, let's talk about collaborations now between communities, health workers, how to collaborate. Or do people have that kind of a collaboration, to help access healthcare?
Okay, yeah. So I think collaboration at this point, you'll be talking more of the stakeholders who have been supporting mainly in terms of funding or technical support. So we need to, of course, we must always recognize the federal government, the Federal Republic of Nigeria, the government of the Federal Republic of Nigeria, for what they have done so far. And also we have some good partners. We have KAI, or some people will call them CHAI. That's the Clinton Health Access Initiative. They've been very supportive for the hepatitis control program. You have some other partners that have played little roles here and there. So, but the collaboration now that we really need now is more of domestic. So we need intersectoral collaboration first and foremost, because remember, there are some important risk factors. One of them is poverty. Poverty, most of the people that will have problem benefiting from hepatitis care are those who actually are spending out of pocket and that out-of-pocket spending to get the drugs is going to ruin them financially and economically. So we need collaboration maybe with other ministries, maybe Ministry of Housing, Ministry of Labor and Productivity. I'm just saying, I'm speaking ideally. We need some kind of social support for these people. Yeah, so that they can, you know, be able to actually afford the care. Or better still, we could just have, okay, that's going to be answered in the next question though. So, but these are some of the collaborations that we're looking for. Already, if you look at from what you say between the communities and you mentioned, is it the health workers or something? Okay, the health workers are there. Okay, they are there. They just need to be trained, their capacity improved. We have community health workers. They are available, but we just need to be able to empower them to be able to do what they need to do. Yes.
All right. Thank you, Mama. You want to come in?
Really, I don't know what to say.
It's all right. Let's go to policies right now.
Okay.
Let's talk about, are there policies on ground that aids, you know, access to healthcare, or would you suggest some policies to be implemented?
Okay, so we actually have the National Framework for Viral Hepatitis Control, which is actually a policy that spans from 2022 to 2026. So actually a lot of well-documented things there, even though I would say partial implementation, we're not really having it reflect nationally. So we have some regional successes as a result of that policy. Take for instance, 2 states that have done very well with hepatitis control are Nasarawa State and Lagos State. So Nasarawa State in particular, they've taken it so seriously. Over 2.5 million people estimated to have been screened, and you know they are sponsoring a lot of treatments. Of course, they are focusing on hepatitis C, but there's a lot of support. Once you are confirmed positive, that treatment is covered, and it's a very expensive treatment. The drugs are very expensive. Okay, so we're seeing regional successes. We're also experiencing, as a fallout of that policy, you know, there was integration of hepatitis care into the primary health system, and also into some programs. For instance, now, of course, if you take your child for immunization, you get the vaccines. So your child is going to get at least 4 vaccines, 1 at birth and 3 others, you know, within the next few months. So so it's part of our national immunization schedule. Even for adults who are at risk, high risk population adults, maybe marginalized communities like the LGBTQ or injection drug, you know, users, or even maybe men who have sex with men, or even health workers, who are at risk. So they can get booster doses of hepatitis vaccines at very affordable rates. So all this is, they've actually integrated it. The only thing now is the focus more is on prevention. Primary prevention. So secondary prevention is early detection and treatment. And that's where we may have a challenge. So when you actually screen and someone is positive, the next thing is it hepatitis B? Lifelong treatment. There is no support system for that for now. Yes, it's, well, arguments are made that it's a bit quite affordable, but then it's not everybody, because some people are living below the poverty line. So it's a struggle. If it's hepatitis C, it's just 3 months treatment, but it's very expensive. Last time I inquired about the drugs, ranging from 400 to 600,000, you know, to get a set
that's serious.
Yes, for 3 months. So I think that is where the policies have not been able to, you know, favor the control for the program. So the I would say government policy is a bit still here, is a bit still on the light. Let's see what will happen with Project 365. I believe it's a short-term thing that would probably escalate into something long-term. Yes, the government has shown quite some sensitivity. Some days ago we heard about the dialysis subsidy.
Yeah, of course.
Yes, so we're hoping that eventually it's going to be like a ripple effect.
Okay.
It's going to get into
the hepatitis
patients. Probably we can replicate the same success stories as countries like Kenya and Egypt. They've done so well with hepatitis control. Yes, there was a lot of political commitment and funding.
Okay.
Yes, and in fact they were able to achieve quite a lot.
Wow.
Yes.
We hope to get there soon.
Yeah.
When you mentioned Nasarawa as being one of those states that have achieved quite a lot, you mentioned Nasarawa and which other states?
Lagos. But Lagos in particular, there's a place in Lagos called Makoko. So Makoko in particular has a very remarkable success story. Wow. Over 90% uptake for that first dose hepatitis vaccine.
Okay.
So that's going to translate to a lot in future, because you have about 90% uptake. So you have children that are already protected that are likely not even going to come down with it in future. So yeah, so you can call that some form of herd immunity if you want to say.
Okay.
So yes, so those are the kind of
all
things.
right, let me now come down to what you see, like in your own corridor of people coming to access healthcare. What is it you can say about your corridor, like here in Akwa Ibom State?
Well, a study was done in 2022. Yeah, just trying to, because we don't have centralized data, for like an overall prevalence. We don't have that, unlike maybe HIV, where we have all those. But we don't have for hepatitis, especially in the state. But we have some pockets, let's say certain local governments.
Okay.
What I'll tell you is that the riverine areas kind of had higher numbers when it came to prevalence for hepatitis B, and that could be because of poor access to care. Okay. Yes, maybe proximity issues, accessing healthcare and all. So, but from what I see, it's just basically what I have, subtly repeated in the course of this interview, that it appears prevention is just better. Okay, so the first dose hepatitis vaccine is very important for our children. And when it comes to immunization services, we are trying. Even though, yes, the data shows that just about 57% of children in the country, actually get, hepatitis B vaccination properly. So it's not it's fair. Okay. It's a pass mark, but it can be better. So in terms of immunization, we're doing well. When it comes to secondary care, secondary prevention, which is, those who are already exposed, so we detect them, and then what next? So what we just see is, people struggle through. I personally have my own personal experience as a student. One of my colleagues, I lost him, while in medical school. We didn't even know he was diagnosed for hepatitis. He kept it to himself quietly, and then until one day his eyes just got yellow, and we now did an investigation and found out that he had been diagnosed, and he was just, I think he was trying other treatments, herbal and other things, and he passed away. So I remember that personally. So we are still seeing people who they try to keep up. For the hepatitis B virus patients, they try, and then maybe at some point in time they will get tired, and then for the hepatitis C patients, yes, the beautiful thing to know that, yes, within 3 months, if you can just take the appropriate drugs, you'll be okay. But then these drugs are not cheap. I just gave you a range earlier on. So we have some who succeed. Maybe if you have a large family, or your children could put something together for you, and you access the drugs, and you'll be fine. So, but we don't see that in the other programs that are getting the support. We don't see that with tuberculosis. We don't see that with HIV. So that's just it. It's
when you mentioned your friend, at least that's one person you saying that could not. I wish the person he spoke out earlier. Yes. Probably you guys would have been able to help him and all that. But among your patients, or I don't know if you've encountered a patient who is faced with some of these barriers, of
Okay,
accessing healthcare?
well, they are there. There are a lot. Not just one, there are a lot.
So how do you help them?
Oh, well, we just, you can't take up the responsibility of all the patients, you know. You just have to encourage them and make them see that, okay, it's just investment, you know, in their health. You know, they just have to try and make effort and see how they can, you know, weather the storm, get their drugs and be faithful to the drugs. For the hepatitis C patients, it's usually easier because it's just see how they can be resolute on gathering the necessary resources, and then they can just complete their treatment. So, well, it's just a mixed story of success here, mixed story of, you know, yes.
So I don't know if there are myths and misconceptions about hepatitis that you would want to debunk today.
Okay, well, yeah, I mentioned some earlier. It's seen as a disease of irresponsibility. So a lot of people feel that it's just purely sexually transmitted, and so they're stigmatized. But what they fail to see is that sometimes we've had if a child, if a mother is positive, because of their measures, there's what we call prevention of mother to child, you know.
Yeah.
Your mother is positive, there are drugs she can commence at some point in time from about 7 months to ensure that the risk of a child getting the infection is very low. Even at that, within 24 hours, the child has to receive the first dose. If the child misses that first dose, which even the World Health has permitted at least within the first 7 days, if not the first 24 hours, but child misses that first dose entirely, the risk is very high of, you know, getting infected. And once that child gets infected, the child already is likely going to come down with those complications I mentioned earlier, later in life, without much resistance, you know. So when you see someone like that as an adult, and, you know, the stigma is there, but you forget that the problem already occurred in childhood, you know, so it's an issue. And then, of course, some people have spiritual implications when they see you with, you know, the swollen belly, the yellow eyes, and they're like, okay, he has matched on something, you know. So there are a lot of spiritual connotations to it as well. But I think there is a gradual enlightenment. Okay. All that is just left now, people are gradually getting to know. All that is just left now is they just need the support to access the care. They are interested, but they just need the support to access the care.
I like what we people are doing now, the healthcare workers, you know, trying to create awareness and all that.
Yes.
But is there something we can do more to create, to hasten the awareness and creation?
Well, I just think, like I said earlier, awareness is not really a problem.
Okay,
I think the awareness now we need to create is to other stakeholders.
to come in.
Yeah, so stakeholders in this case, you know, you know, number one, our guys at the top, you know, we need to make them see the how this is going to, what's the public health impact? You know, what's the long-term gain? I know that yes, most times government may be interested in tangible projects that can be palpated immediately, but we just need to make them see, you know, that okay, if we invest in this, we are going to actually be having a healthier society, which is going to translate into better things like better productivity. So I think those are the number one stakeholders that we should be creating more awareness for. Yes, and then maybe we can look at other partners, you know, both domestic and outside. Yes, but I really don't want us to be so dependent on partners, but yes, we can't do without them for now. So we need to create an awareness with them. We need to also create awareness for community leaders and religious leaders, so that they can also help to dispel some of these myths and you know, misconceptions. Yes.
Thank you so much, Dr. Akpan. I'm just going to give you 1 minute to give us a closing remark.
Okay, so
thank you, doctor. Thank you so much for being with us.
Thank you very much. Thank you so much for giving this opportunity to just shed some light on this very sensitive topic. And honestly speaking, I'm very positive that we will eventually get to the point where, you know, this situation will get the attention it actually deserves. Yes, and then we can actually get support for our people who are dealing with it, struggling hard to actually meet up with them, you know, with care, getting adequate care. I'm also appealing to all those who it's within their power to influence, you know, the right action, that they should actually
change.
Yes, they should actually take a decision and act now.
All right.
Yes.
Thank you so much for sharing your expertise and insight on hepatitis.
Thank you very much.
All right, let's continue to shine a light on this critical health issue and work together towards a future where hepatitis is no longer a silent threat. Until next time on Softline, stay informed, stay empowered, and stay healthy. Bye-bye for now.